I thought we'd decide to go a different plan of attack for today's presentation is, but I think it's still relevant in this current context of coronavirus, especially in Victoria with the healthcare, aged care and childcare sector, or the healthcare sector classified as one, and what's actually going on and what's actually happening in this point in time. So basically, we're just anyone who helps other people in a physical capacity. And why do we constantly see injuries within the workplace, whether it's lower back issues, whether it's trips, falls, sprains, but majority of it, well, tonight I'm actually going to talk specifically about the manual handling. And I think the manual handling side is one of those sides that can be easily prevented. I'm going to specifically talk about lifting injuries. So some of the most prevalent injuries within the workplace for aged care, for aged health and childcare. And they're usually a result of fatigue, time constraints, pressure at work, unsuitable equipment. The unsuitable equipment seems to be specifically for childcare, whether it is the equipment is always suited towards the kids, unsuitable for the staff to actually use, and it might have a lack of equipment for the actual staff themselves. So the actual ergonomics, poor lifting practices, super prevalent within the childcare, especially when you're working with all the younger tots. They've got to get the diapers changed, running around like headless chooks and all that. That's specifically if you've got to change them over, and if you're a short lady or small lady, and especially if the equipment is unsuitable or the bench is too high or something like that, you're overreaching, and basically it's going to increase the likelihood of injury. What would the numbers say for childcare? So this is WorkSafe Victoria. So the most common injuries were musculoskeletal injuries, so 767 reports, and this was between 2010 and 2015. And there was 265 cases of mental disorders, and I thought that was quite interesting to actually put in there. But the common causes were actually due to falls, trips, slips, and body stress. So body stress is more got to do with the manual handling at the end of the day. Many that suffered injuries cannot return back to work and require assistance living themselves. So what the numbers say for aged care, aged and healthcare, so they kind of get branched together because you can become a EN and an RN, and RN allows you to work in the hospitals, EN allows you to work in aged care. And this is from WorkCover Queensland, this information. And from the 2014-2015, there was 40,000 claims were lodged for musculoskeletal injuries within Queensland. Three main reasons: lifting, carrying and putting down objects, falls, and repetitive movement or strain. And the average claim was $7,056. And all I did was I times that by 40,000 claims, ended up being $282 million. So whether or not all 40,000 claims were actually met, it's still a big, massive chunk of money that is actually going to try and fix people. So what's the solution? So strength testing for all nurses and childcare workers. And the reason why I kind of thought of this is coppers and firefighters actually have to undergo physical testing. There's a physical requirement for those jobs, but when it comes to the police and firefighters, you're not always, jumping over fences. You're not always, knocking down doors. You're not always, putting out fires. You're not always trying to manhandle someone to arrest them. It's just not happening all the time. But with nurses and childcare workers, we know they're frequently lifting, moving, putting themselves in exposed positions to assist in the care of someone else. Because someone has lost their strength and mobility, they have to gain it from somewhere else in order to move somewhere. Universities, TAFEs, and RTOs have to have units on the demand of the job. So we can't sugarcoat it and say, just go through and learn how to actually, or learn the physiology side, or learn about medication and all that jazz. And there needs to be another component where there's an actual health component where they actually look after themselves. There needs to be something in there. All workplaces to drive initiatives to encourage staff to become physically active. And I think this is really important just for the in terms of dealing with the fatigue side, the stress side, in terms of the well-being side, but in terms of the physical development of the individual. So we're making sure that the nurses are strong enough so they're not going to feel like they're overworked. Because if they're really strong and requires a little bit of strain in order to move someone versus someone who's really weak, that it might require all their might to actually help and assist and move that person. We know the person who's going to be more burnt out is the weaker individual, or more likely to be burnt out. Manual handling will always be required on a daily basis. Doesn't matter what job it is, whether it's a low threshold or a high threshold. Healthcare, childcare, aged care, there's always some lifting that is required. And sometimes it could be at the start of the shift when you're feeling fresh, and sometimes it could be at the end of the shift where you're feeling really fatigued and just mentally cooked. And there's seven times higher developing a musculoskeletal injury compared to the general population. So if you're more likely to develop a musculoskeletal injury, let's develop the musculoskeletal system. Let's get them strong. Pretty simple. And that's it.